I am going to be speaking with a panel of pharmacists on best practices for vaccines after stem cell transplant or cellular therapies. There are two other colleagues there. One is going to be speaking on an overview on the guidelines and where vaccines fit in the current guidelines, both for stem cell transplant patients and CAR T patients. He's also going to highlight how COVID vaccines fit into this as well. Another colleague is going to speak on the immunology and benefit and challenges of titer-based vaccines after stem cell transplant. And then I am going to finish up the discussion on how we run a pharmacist-run vaccine clinic at the University of Minnesota Pediatric Center. I'm going to highlight how the pharmacists are involved with having discussions directly with the family on which vaccines to get, how we coordinate their vaccine care after stem cell transplant. And then I'm going to also touch on challenging questions that caregivers can have with patients or caregivers when it comes to vaccinations, and how to address those questions with either the patients or their family members. And then I'm going to finish up by speaking on the newer FDA-approved vaccines that are newer to the market and where they fit in the current guidelines. And those specifically are pneumococcal vaccines and then meningitis vaccines. In our BMT clinic that our patients visit after they've gotten their stem cell transplant or cellular therapy, at several points along their transplant process, between 100 days out and 2 years out, the pharmacists meet with the patients. And some of these times that we meet with them is for our vaccination consult service. So the different things that pharmacists can do to facilitate and complement the team is actually take over the whole vaccination process for our patients. Here at our institution, we manage the vaccination process. We make sure all the correct vaccines are ordered. We know they're coming ahead of time, so we're able to coordinate with the actual infusion pharmacy to have the vaccines ready for them, and that our staff is ready to administer the vaccines as long as the patients consent, so that they can really reduce their waiting time. We also are able to look at when our patients are here and then they transfer home, they have to get some of their vaccinations not at our facility. So we're able to go through and review the different products, if it's different brand vaccines, and make sure that the one they got at home versus our institution are interchangeable, and that they're still on track to keep up to date on these vaccinations post-transplant. I spend a lot of time speaking to families about concerns of how they have different feelings about vaccinations. A majority of patients or caregivers are okay with vaccinations and receiving vaccines after transplant. They understand the utility and the validity of using them. But there are times where I have more interesting conversations, or people have very specific current concerns regarding vaccines, and I'm able to do a deeper conversation with them. When we spend time talking to families about why they're concerned about vaccines, sometimes it's really just one vaccine that they're worried about, or that they're getting so many at the same time. And so working through what is concerning them can be really helpful to ensure that the patient themselves end up getting the vaccines they need after transplant, and that the family is comfortable with it as well. So, and then to finish up, pharmacists can also administer vaccines. So we can take that on as well, depending on the guidelines and laws of the individual states.